Greetings, YouTube. How are we doing today? Saturday, November 14th. This is XCal505. I just want to again thank everybody for comments and ratings. um, last Friday, um, my daughter got hit. She got sick with what they call RSV. Okay, it's a respiratory something or another virus. Okay, um, where she had a continuous cough, would not stop. We couldn't get it to stop, no matter how much Tylenol or how much Motrin we pumped into her. Um, we couldn't get it to stop. So last Saturday morning, we took her to the ER. And now, from my understanding, from what the doctor, so-called doctor, told us in the emergency room, that RSV mostly hits kids under 3. So how she got it is beyond me. More than likely, she picked it up from one of the kids at the Halloween party that we went to. Um, but you don't know what it is. You think it's just a simple sniffle. Okay, so if you're in Lee County, you need to make sure that you watch your kid for that RSV. Okay, I'm keeping my daughter out of school until she doesn't have a fever and she's over the cough. Okay, I don't care how long it takes. I will go to the school and get her homework for her, and we will teach her here at the house. That's not a problem for me. It might be a problem for the school and HRS, but they can blow me. Sorry, excuse me. But in any effect, this is the kicker I wanted to talk to. Well, right now, well, here's a stupid thing: is they give her a breath thing, a nebulizer treatment at the hospital, and then send her home with some cough syrup. And check this out: they're pumping my 6-year-old kid up with codeine. Codeine, number 4, in a cough syrup. Now, it did help. The only thing I didn't like is that when I give it to her, uh, it knocks her out and she's done. So I cut the dose in half just so that it'll suppress the cough a little bit, but I don't want her to be uh, comatose, okay, and unresponsive. So I cut the dose in half. They said 2.5 mils, and I cut it to 1.25. Um, and that seems to be doing okay. It's suppressing the cough. Her pain's not as bad from when she was coughing continuously for 3 days, uh, and it's made it easier on her. So if and see, the kicker is this: is we're on state health care. Well, she is. Okay, I don't have insurance. She's on stay well from the state. Okay. Now, the state doctors, I don't know where they get their licenses from. Okay. Last year she went to this one doctor and they told my wife that my daughter was allergic to fish scales. That was a moment of silence for you to say, what the fuck is he talking? What? Fish scales. Yeah. She takes her pet out of the bowl. A little pet bed of fish. She takes it, which doesn't have scales. Takes it out of the bowl. She pets it, caresses it, takes it for walks, brings it to the beach. Yeah. Okay. So, so if you're in Lee County and your kid is on state health care, PPC, Primary Physician's Care on Biscaya Parkway in Cape Coral. They accept Stay Well Now. So I would suggest that if you're going to one of these silly ass state doctors, transfer, okay? Because those doctors know what they're doing, okay? This doctor we saw, he hooked her up with some penicillin. What did we give her? Amoxicillin. Okay, hooked her up with some amoxicillin, and she's not coughing as much. Okay, she got an ear infection from the RSV. That's starting to diminish. She's not coughing as much. She's not hacking as badly. The cough isn't as deep. And she is actually starting to feel better. Okay, I'm still hitting her with a little bit of the codeine because, I don't want her to be in too much pain. But I'm not giving them as much as they told me to give her because I don't like it when she is non-responsive. Okay? Maybe when she's sleeping, I'll go ahead and, before she goes to bed, I'll give her a little bit more. But that's just to get her to go to sleep so she doesn't have to cough. But here's what I really wanted to talk to you about and show you is, I don't know, can you see that? Dear parents, this is from the Lee County Health Department, okay? And I'm going to read this real quick for you. Let me turn this light on so I can see it. With the continued media attention about H1N1, swine flu, and vaccines, the Lee County Health Department would like to help keep you informed about area efforts to keep your family healthy. H1N1 is a serious threat to the health of our families, unlike any we've seen in our lifetime. That's right, because it is a man-made biological weapon. We have no immunity to H1N1, and it can lead to severe sickness and even death in most cases. Yes, because your body reacts to the swine flu, which really doesn't do much damage to you. It's your own immune system fighting your own body. Okay, for most people, H1N1 is a mild illness. However, there is a risk of serious consequence even in young, healthy people. Since April, 86 American children have died from the H1N1. However, in just the last 2 months, 39 children have died from the H1N1. 30% of those children had no underlying medical conditions. That is true because H1N1 doesn't do that to you. It's your own immune system. The threat from H1N1 can be prevented simply. You have simply, not my guess, I don't know, they must have, you have been practicing good hand washing and keeping sick children home from school. Now we can offer another tool to protect your family. Everyone in your family should get vaccinated. Yeah, right. The vaccines may be available from your family physicians. Also, the Lee County Health Department is embarking on an unprecedented campaign to offer vaccines in our entire community. These vaccines are voluntary and free. There's the two key words at this moment in time: voluntary and free. Everybody wants free stuff. The Lee County Department of Health plans to begin H1N1 vaccinations clinics later this month in area high schools. Free vaccinations will be given to those at 12 location high schools. Okay, if you would like more information, you can contact the Lee County Department of Health. It's coming. It's coming. Soon it will not be voluntary. Soon it will be mandatory. And I'll tell you right now, if they try to shoot my kid up with something in school without me knowing it and without my knowledge, somebody's going to die. And it's not going to be my kid. So that's it. Y'all, peace out. Have a good day. Talk to you later.